Good evening, Peter Goertz. I'm a psychiatrist. Let's talk about an issue that seems quite obvious, but that is not very frequently talked about. Sexual attraction between patients and psychiatrists. And in the past, apparently some psychiatrists have actually married their patients. So we're talking about attraction to the psychiatrist from a patient's perspective, and then the other way around, attraction of a psychiatrist toward a patient, and one or the other can be present or both together. And there are boundary issues, of course, involved. And one example I'm thinking of is when I was a resident, there was a gastroenterologist who actually dated residents that he was supervising. And that in itself, to me, seems to be a boundary issue. But then later on down the road, I realized, I was told, and apparently it's true, that he actually sexually abused patients during gastroenterology procedures. So boundaries are an issue for all of us to be very careful with, and we want to be aware of what our feelings are in order to work with the boundaries and set appropriate boundaries and observe appropriate boundaries. A few examples. When I was in private practice, one of my patients during a visit just asked me out. And I was a little surprised. And I said, that is not a good idea. I'm your psychiatrist. And that was it. And I continued to treat the patient. So if we're open, these things can be put on the table and at least briefly touched on or discussed, and then one can move on with the treatment. Another patient I remember was a patient who came to the emergency room, and she was quite upset and caustic, and she was there with a girlfriend, and she was very abusive, as far as I recall, verbally abusive, and quite annoyed and angry at the girlfriend, and was berating her girlfriend. And then all of a sudden she turned to me and said, "Are you married?" So that, I'm not sure what I said at that point, but it was pretty obvious that that was not something to pursue. Another patient on a ward, at one point, a young lady said, "If I wasn't on this ward as a patient and you weren't my doctor, we would be going out." So these things can come up directly from patients, and you want to realize that these things can be put on the table at a moment's notice, and you want to be aware of your feelings and how you might respond when patients say things like that. And various things can happen. Even I was working on a psychiatric ward, and at one point, a patient whom I had dated prior to that, quite some time, I think years before that, was actually admitted to that psychiatric ward. I was not her psychiatrist on that ward, but she was on that ward. So various situations can occur that can be quite challenging. And as always, we want to try our best to be aware of our emotions. If we're not aware of them, we might act on them in ways that would really not be appropriate or constructive. So we want to be very careful. One issue, obvious issue, if we're considering the issue of sexual interactions between a patient and a psychiatrist, is it seems inappropriate, or it is inappropriate in my opinion, based on a very simple inequality, because the psychiatrist knows personal information about the patient, and the patient may know very little about the psychiatrist. So the basic foundation of the interaction is inherently unequal. And that, of course, does not mean the psychiatrist is better than the patient. It has nothing to do with that. But there's an inherent inequality in that the psychiatrist is treating the patient and knows at least some personal information about the patient, and the patient probably knows quite little personal information about the psychiatrist. And the same goes for former patients. So if a psychiatrist were to want to date a former patient, again, you would have that inherent inequality, and it's not appropriate, in my opinion, to date former patients as a psychiatrist. And we're talking about people, psychiatric patients are often quite vulnerable, and we want to be aware of that. And in general, it's not a good thing to take advantage of vulnerable people. For example, patients on psychiatric wards at times have had sex with each other, but it's probably, or in my opinion, it's definitely not a good idea, because people can get preyed on. People, let's say in a psychotic episode, are not ready to really consent to sexual interactions. If someone is overwhelmed in any way, not just in a psychotic episode, it's not a time for them to be able to consent to sexual interactions. And boundaries are another issue, or an issue in another way also. As an example, for example, if a resident, so a psychiatrist in training, were to have a sexual relationship with a medical student, that would also not be appropriate, in my opinion, or is not appropriate in my opinion, because again, there's an inherent inequality, and there's also, in that scenario, a dependence of the medical student on the psychiatrist, or on the resident in that scenario, or potentially a dependence on the resident, because the resident would give an evaluation of the student potentially, and the student may depend on a good evaluation in their career. So that may make a difference in their career. So there's an inherent inequality again in that situation. If one person is a resident and another person is a medical student being supervised or being taught by that resident. Now, if we're, as a psychiatrist, sitting in front of a patient whom we're sexually attracted to, does that have to interfere with treatment? In my opinion, it would affect treatment probably, just like anything, or could affect treatment, just like anything could affect treatment. You know, if whatever emotion we have about a patient could affect the treatment, but might not necessarily interfere with the treatment. So we want to really be careful and, as best we can, make the decision whether our feelings about a patient, whether they're sexual or other feelings, affect the treatment, but that we're aware of that effect and can move on and treat the patient, or if those feelings about a patient affect the treatment to a point that they interfere with the treatment. So we do not want sexual feelings toward a patient to interfere with the treatment, just like in the other direction, if a patient has sexual feelings towards a psychiatrist, we want to look at whether that would just affect the treatment or would actually interfere with the treatment. And that type of issue goes not just for sexual feelings, but also, let's say, if a patient is perceived as rude by a psychiatrist and the psychiatrist is annoyed by that, that might affect the treatment in that visit, but wouldn't necessarily interfere in a major way with the ongoing treatment. Same thing if a psychiatrist is annoyed because a patient has dirty pants and sits down in a clean chair and maybe even stains the chair. That might be annoying for the psychiatrist, but would not necessarily interfere overall with the treatment. Or, for example, if a patient were late or talking a lot during the session. Various things might annoy a psychiatrist, but not necessarily to the extent that they would interfere in general with the treatment of the patient. Now, these issues can be a legal issue also, or turn into a legal issue, because if a psychiatrist were to act on sexual feelings toward a patient, that could, of course, lead to a lawsuit by the patient and cause a legal problem. So, as a psychiatrist, from our direction, if a psychiatrist is sexually attracted to a patient, our question again is, does it interfere with treatment? Am I aware of my feelings? Can I still treat this patient? Or is it a good idea for the patient to switch doctors, switch psychiatrists? Another option is to get supervision if you're not sure as a psychiatrist how to proceed in a scenario that involves sexual attraction to the patient. If you're not sure, it can be useful to ask another psychiatrist their opinion. So basically to get some supervision by another psychiatrist regarding the issue. Thank you very much.